Now I'd like to, I believe, welcome in person Erik Schultes, who is going to speak on behalf of Margreet Bloemers and Aliya Aktau.
So, hello everyone, and good afternoon local time in Leiden to everyone else out there in the world. I would like to make a short presentation today, but also on behalf of my collaborators, Margreet Bloemers from our Dutch national funding organization called ZonMw, and also Aliya Aktau, who's a colleague of mine at the Leiden University Medical Center. And Miriam asked us to present kind of a status update today on interoperability in VODAN. And so this is the I in FAIR. And I'm gonna do this. Okay, super. And I'll go here. Oh, I get it. Okay. So interoperability itself is pretty abstract. So to really kind of ground it in the context, explicitly for VODAN-Africa, it is in this context of FAIR data visiting. And so I just wanted to kind of parse out what do we mean exactly by FAIR and what do we mean by data visiting. And so here's sort of in a principled way, what we mean FAIR is really getting at this idea of machine actionability. So more and more we want to automate the F, A, I, and R functions so that the machine can do this more and more on its own. The data visiting aspect is, I think it's been really well presented today. Certainly, you know, all the way from the Vice Chancellor down, we've been hearing about how important this is and will be important not only in Africa, but is recognized as well in the Netherlands as a really important use case. But the idea here is that the data shall not be copied and distributed, but in fact, queries and algorithms can come to that data in a localized setting and accessed under the rules and conditions set by that local data owner, that local organization. Beginning around this time 2 years ago, a number of projects grew up fueled by the urgency around COVID. VODAN was one of them. That's the first one I'm listing here. And this was with GoFair and the Philips organization behind it. There was initial projects in FAIR data points at the Leiden University Medical Center, and that has also continued to grow in Leiden. Those were initially funded by ZonMw. And there was another project which started on the heels of VODAN, which was the Dutch National COVID-19 program. So I think it was ended up being about 52 million euros total. It's 130 projects, broad spectrum research on COVID. So this was a program that launched very quickly following the work we were doing in VODAN. And so what I'd like to do in terms of discussing interoperability now and FAIR data visiting, I will just give a brief overview, just a snapshot of what these architectures look like for these three projects as they've grown up over the last 2 years. And obviously there's no time to go into details here, but I am going to highlight the role of CDAR and the role CDAR plays in the interoperability aspects of these architectures. So principally what CDAR is trying to do is allowing local data producers to craft metadata that is fit to their purpose, and in fact can be fit to their local governance policies, etc. The CDAR workbench allows you to create metadata schema and to use controlled vocabularies, which are important for this machine actionability. The architecture that is now emerging at the Leiden University Medical Center is also using CDAR and deploying CDAR for these same purposes. And then this is a snapshot of an early stage in the COVID-19 program, where we were running a series of metadata for machine workshops to get input from these 130 projects, these 130 stakeholders in the COVID program, to boil down the metadata descriptions and the vocabularies for the COVID-19 research program. Again, CDAR was playing a central role in that data, and metadata is now exposed at the Health RI portal. So although these are three very different architectures and there's a lot of complexity here, if we look at it through the lens of the FAIR principles, we can really see that they are representing an approach to FAIR that can be summarized in this hourglass architecture. And the idea here is that the shape of the hourglass is indicating the freedom to operate. So if you want to implement FAIR data visiting, at the top and the bottom of the hourglass, you are free to do your data creation or your data analysis as you see fit, using the tools and specifications that you like. The idea is that from the top down, there's this verification step, the blue part, and that's getting us from this maybe even handwritten medical records into a verified form, which is at the center of the hourglass. And this is to say that at the center we want data and metadata that are machine actionable. That's the requirement. And we can go into details about what that means, and we can see that there are numerous emerging standards now for what that is. But once you have machine actionability, then you open up the door to the orchestration of that FAIR data and metadata to do many things, among which is the data visiting functions. And we can map all of these architectures onto this hourglass approach, but here's what VODAN-Africa looks in that way. So we have 88 stakeholders at the top doing things locally as they see fit, creating data in all kinds of different formats, but using CDAR through these metadata for machine workshops, they're able to produce machine actionable, technology independent data descriptions at the center, but then that opens up the door for the orchestration of that, including data visiting. So to kind of summarize this, or we would certainly expect to see a high degree of interoperability in any of these three projects. But the real question that we're going to face very soon now is, are we going to find interoperability between these projects? After all, if these three projects are claiming to be creating FAIR data, then they should be automatically interoperable already without a lot of human intervention. We can certainly put this to the test now, and we should. I suspect CDAR metadata is playing a critical role in this interoperability. But the idea here is if we put this to the test, if we try to run a query, or if we try to send algorithms between these different networks, if it doesn't work, if there are interoperability issues, we're going to learn a lot. We're going to spot gaps, and we're going to understand much better about how to iterate FAIR, or to implement FAIR in the next iteration. So this interoperability challenge that my colleagues and I would like to kind of frame today is not just sort of abstract, but I think there's some really nice self-imposed deadlines. Leiden is, after all, the European City of Science starting this year. There's a year-long celebration in Leiden around this honor. In October, in particular 24th to 28th, two important organizations will be here as part of these celebrations: CODATA and the FAIR Digital Object Forum. And I would, we would like to look to this moment in October when maybe VODAN, Leiden University Medical Center, and the COVID program could actually claim some sort of interoperability between these three independent efforts. And with that, I'd like to say farewell. Thank you very much.
Thank you so much, Erik.